My name's Amy Behman, and I'm an orthopedic surgeon here at Duke Health. I treat children with limb deformities and with issues with the lower extremity, and then I treat hip problems in children and then also the sequelae of those hip problems from childhood and young adults. With a lot of the limb deformity problems, children can have functional limitations, and so trying to treat their limb deformity can help them get back to functioning and doing all of the day-to-day things of childhood, running, playing, doing sports, all of those things. And then on the hip side of things, usually children will have pain, and that may last into adolescence and young adulthood. So the purpose of hip preservation surgery is to treat those hips and to create a stable joint that is pain-free, and really to avoid needing a hip replacement and to try to preserve the natural hip. I do a lot of accounting for growth and a lot of using growth to help treat limb deformity. And so that's something that I really enjoy, is kind of harnessing growth and using that to actually treat some conditions. So I think my real care philosophy when it comes to patients is trying to identify what issues are really affecting them, and then really using a shared decision-making approach to try to come up with a plan that best suits the patient's needs and their desires, and helps them get the goals that they want to reach from the treatment. So I kind of provide guidance based on my expertise and my knowledge, but really try to make decisions with the patient, especially when there are different options, to try to really get them engaged in that decision-making process. I think the things that get me the most excited as a physician are getting kids back to functioning and getting people out of pain and getting them back to doing the things that they love doing. So that's kind of everything that I want to do, is to help people live a better quality of life and to really improve people's quality of life.